but those who are unvaccinated will have to undergo regular COVID testing. So let's discuss today's mask reversal with Dr. Andre Campbell of UCSF. This is not a piece of welcome news for many folks. Explain the change.
So, Heather and Alex, thanks for having me this afternoon. First thing is that we have to remember that this is very much a dynamic situation. So when the CDC made the recommendations a few weeks ago, the Delta variant was only 1% of infections. Now that number is 86%. So what it means is that it's gone up, so that we're entering a period where the dynamics of the virus infection or pandemic has changed. We know it's a pandemic of the unvaccinated, but the thing that graph that you showed is that what it's showing is that greater than 60% of the country is in areas that have high or substantial transmission. So if you're high or substantial, that means the risk of spreading the virus is high, and therefore that's why they're going back to masking. I know it's confusing, It's hard, nobody likes it, right? And it's difficult, but that's what this is about, the changing nature of the pandemic.
But doctor, if it is in fact a pandemic of the unvaccinated, I'm fully vaccinated, why do I need to wear a mask?
So the thing that's new also, which is what if we drill down further, when they drill down to the numbers, is that even if you are vaccinated, you can spread the virus. So people who are unvaccinated, they spread the virus and they get it. You will not get sick, or you won't go to the hospital if you're vaccinated, but you could still spread the virus. And there's some suggestion now, and that's another new thing, that if you are vaccinated, you can spread the virus. So this is also something that's quite new.
Okay, more and more details coming out as this continues to go on. Doctor, the CDC also saying today students, teachers, staff should all be masked indoors at school. What do you make of that recommendation?
Well, I think we have to open up the schools. And the way to do that safely is to make sure that we don't spread the virus. And the way that we know that you don't spread the virus is to wear a mask. Right now, if you're 12 and up, you can get the vaccine, but it's not going to be until October or November until we can actually get to the point where the kids can get vaccinated. So therefore, in order to make sure there's no spread, that's why they're recommending this. It's all about abundance of caution, and they're sort of trying to err on the side where they won't spread the infection. The last thing you want to do is have the kids be a reservoir inside the schools, infect the teachers infect the kids, that kind of thing. So wearing a mask, that's what it's about. But we got to get the kids back into school. I mean, everybody agrees with that.
Yeah, we have, though, throughout this pandemic, seen the mask guidance change. Do you think that this sort of flip-flop, if you will, is going to erode, public confidence in what the CDC is saying and what we're being told?
Well, I think that's definitely a danger. I think we have to understand is that this virus, this pandemic is changing. And what we have to do is act with the information that we have. If the information shows that we need to change what we're doing, we got to change what we're doing. Now, I know that they say mask on, mask off, mask on, mask off. But the reality is that, okay, now we have the Delta variant. It is the dominant infection in the country. And because it's the dominant infection, it'll infect, instead of infecting 1 or 2 people in a family, it'll infect 8. There are thousands of more virus particles that get replicated from this virus, the Delta variant. So that what we're trying to do is make sure that it doesn't spread any more than it is.
Dr. Andre Campbell of UCSF, really appreciate your time today. Thanks so much for joining us once again.
Thank you for having me.
Governor Newsom was in the Central Valley today, highlighting the state's efforts to improve health care.